Hi everyone, this is Miss O'Brien. In this presentation, we're going to go over Chapter 7 of your local anesthesia textbook, and this is the chapter on dosage calculations. So in this chapter, we're going to discuss calculation and recording of drug doses, maximum recommended doses, limiting drug, dose modifications, and dosing with multiple drugs. So when calculating local anesthetic doses, the key factors to keep in mind are the concentration for selected anesthetic, the dilution percentages for vasoconstrictors, the standard cartridge volumes, the MRDs or maximum recommended doses, and relevant patient factors. This would be things like weight or health status or medications. Now the maximum recommended dose, you'll often see this abbreviated as MRD, and this is the maximum quantity of a drug that may be safely administered during an appointment in most situations. And the dose recommendations are provided by the FDA and also by manufacturers in the product inserts. So this is table 7-1 of your textbook, and this lists the FDA approved maximum doses of local anesthetic drugs. So you can see here's some common local anesthetic drugs on the left-hand side here. So each drug, they give an MRD based on milligrams per pound. You can see lidocaine, that's a very common local anesthetic that we use a lot. The MRD for that is 3.2 milligrams per pound. They also give it in the value of milligrams per kilogram, which we don't use so much in the United States, but if you were measuring weight in kilograms, it would be 7.0 milligrams of lidocaine per kilogram. And then this column lists the, this is the absolute MRD. So for lidocaine, 500 milligrams is the absolute MRD. So no matter what a patient weighs, you cannot exceed 500 milligrams of lidocaine in one appointment. So to illustrate this, let's take a 100-pound patient. Let's say your patient's 100 pounds and you want to determine the MRD of lidocaine for this patient. You would take 100 pounds times 3.2 milligrams per pound, and you would find that this patient has an MRD of 320 milligrams based on their weight. So this does not exceed the 500 milligram MRD total. So 320 milligrams will be your MRD for that patient. So if you had a patient that was 200 pounds, the MRD for lidocaine based on weight, it would be 3.2 times 200. That's 640 milligrams, or I'm sorry, 640 milligrams. So the problem there is that the 640 milligrams MRD that you get based on the patient's weight exceeds this maximum MRD. So you can't give that patient 640 milligrams, even though their weight dictates that. You have to stop at 500 milligrams because that's the absolute maximum. So if you find that your patient's weight, when you multiply that by the MRD, if that exceeds that absolute MRD, you would have to go with the lower of the two. So even though your 200-pound patient technically has a 640 milligram MRD for lidocaine, you cannot give them any more than 500 milligrams, so their MRD is actually 500 milligrams. Okay, so factors required for dose calculations. This is going to be the local anesthetic drugs are diluted. So like we learned in week 1, when you have a local anesthetic cartridge, there's a lot of things in there, not just the local anesthetic. There's distilled water, there's vasoconstrictor possibly, there's preservatives, there's much more than just the local anesthetics. So the local anesthetic, it's referred to as a concentration. So the local anesthetic is always going to be expressed as a percentage. So for instance, you have 2% lidocaine or 3% mepivacaine or 4% articaine. That will always be printed on the cartridge, so that information is readily available. So then there's also the volumes and doses that are delivered. So the solution is expressed in milliliters, and the drug, such as the local anesthetic or the vasoconstrictor, is expressed in milligrams. And then you have the drug MRD to consider. Okay, so drug percentage conversions, your book just points out that 1 milliliter equals 1 cc. We never really express any of our values in cc's, but just keep in mind that 1 milliliter does equal 1 cc. And then 100% of solution will equal 100 milligrams per milliliter, and we'll see why that's important in the next few slides. 1 cartridge of local anesthetic solution will contain 1.8 milliliters of solution. Remember, the cartridge is going to be labeled 1.7 milliliters, but that's just the minimum guarantee. So you want to do all your calculations based on 1.8 milliliters because that cartridge will more likely hold closer to 1.8 milliliters than 1.7. So just remember, always use 1.8 milliliters for all your calculations. And then a 1% solution is going to have 10 milligrams of whatever drug it is per milliliter. So if you have a 1% lidocaine, you would have 10 milligrams of lidocaine per milliliters of solution. And then in a cartridge, if you had a 1% formulation, let's just say 1% lidocaine, that would mean you have 10 milligrams of lidocaine per milliliters of solution. And so if you wanted to find out how much lidocaine was in that cartridge, you would multiply that by the size of the cartridge, 1.8 milliliters, and you would find out that if you had 1% lidocaine, you would have 18 milligrams of lidocaine in each cartridge. So there's actually no 1% formulation of lidocaine. I just gave that as an example. Okay, and this table just basically says what I just told you guys. So just remember, 1 cartridge is 1.8 milliliters of solution, and a 1% solution is 10 milligrams of the drug per milliliter. So if you had a 1% lidocaine, you would have 10 milligrams of lidocaine per milliliters in that solution. So if you just memorize that one thing, 1% solution equals 10 milligrams per milliliter, then you can just figure out all this. You don't have to memorize this. If you know that 1% equals 10 milligrams per milliliter, then 2% equals 20 milligrams per milliliter. 3% equals 30 milligrams per milliliter. So all you have to do is memorize that a 1% solution has 10 milligrams per milliliter of local anesthetic in the cartridge. Therefore, a 0.5% solution is going to have 5 milligrams per milliliter. A 2% solution will have 20 milligrams per milliliter. 3% solution, 30 milligrams per milliliter. 4%, 40 milligrams per milliliter. So just remember that one thing, and then you can kind of deduce everything else. And the percentage of local anesthetic, it's always listed on the cartridge. So it's going to say 0.5% bupivacaine, or 2% lidocaine, or 3% mepivacaine. It will always be printed on the cartridge, so you know what percentage you're working with. So just again, if we have 2% lidocaine, it's going to be 20 milligrams of lidocaine per milliliter of solution. If we have 3% mepivacaine, it's going to be 30 milligrams of mepivacaine per milliliter of solution. Okay, so how much is in each cartridge? So what we're going to do is, again, the cartridge is going to be labeled 1.7 milliliters, but that just means that there's a minimum of 1.7 milliliters in there. So we're always going to use 1.8 milliliters for our calculations. So you're going to multiply the number of milligrams of anesthetic in the solution by the size of the cartridge, and that will tell you how much of that anesthetic is in each cartridge. So with a 2% lidocaine formulation, we know that 2% means there's 20 milligrams of lidocaine per milliliters of solution. So in order to find out how much is in that cartridge, we need to multiply that by the size of the cartridge, 1.8 milliliters. So when we multiply 20 milligrams per milliliter times 1.8 milliliters, our milliliters cancel out, and then we find that there's 36 milligrams of lidocaine in one 1.7 milliliter cartridge of 2% lidocaine. Okay? And then 3% mepivacaine. Remember, 3% solutions mean there's 30 milligrams of the local anesthetic per milliliter. So 30 milligrams of mepivacaine per milliliter, And then we multiply that by the size of the cartridge, 1.8 milliliters. And when we multiply those, we find that there's 54 milligrams of mepivacaine in one 1.7 milliliter cartridge. Okay, so dose-related MRD. The MRDs of local anesthetics are all listed on that table 7-1 on page 89, and they're based on the patient's weight, but also there's a maximum MRD that you cannot exceed regardless of the weight. So as we learned with lidocaine, the MRD is 3.2 milligrams per pound, but there's a maximum MRD of 500 milligrams. So you cannot exceed that 500 milligrams no matter what the patient's weight might be. And we determine the MRD by multiplying the patient's weight by the MRD. Okay, so here's our chart again. So lidocaine, this is the most popular, so I always kind of tend to use this. But the MRD for lidocaine is 3.2 milligrams per pound. And then the maximum is 500 milligrams in any one appointment, no matter what the patient weighs. Okay, so example, the MRD for lidocaine is 3.2 milligrams per pound, and you cannot exceed 500 milligrams per appointment. So if your patient is 100 pounds, you just multiply 100 pounds times 3.2 milligrams per pound, and you find that their MRD is 320 milligrams. So as long as that value is less than the maximum MRD, you're fine. You would use the lower of the two. So 320 milligrams would be her maximum recommended dose, which is lower than the 500 milligrams absolute maximum. Okay, say you have a much bigger patient. This is a 225-pound patient who is more than twice as much, weighs more than twice as much as your previous patient. So with this patient, you would take 225 pounds times 3.2 milligrams per pound, and this would give you an MRD of 720 milligrams. So the problem here is that even though that's the MRD based on weight, it exceeds this 500 milligram absolute MRD. So you have to take the lower of those two, otherwise you risk overdosing your patient. So for this patient, even though based on weight it's 720 milligrams, the MRD for this patient is 500 milligrams because nobody gets more than 500 milligrams of lidocaine. That's the absolute MRD. Okay, so how many cartridges of 2% lidocaine can you give to this 100-pound patient? So based on our calculations, we know that the MRD for our 100-pound patient is 100 pounds times 3.2 milligrams per pound, meaning that we can give them 320 milligrams. That's that patient's MRD. So for 2% lidocaine, how much lidocaine is in a cartridge? 2% lidocaine means there's 20 milligrams of lidocaine per milliliter in that solution. So the size of the cartridge is 1.8 milliliters. So we need to multiply 20 milligrams per milliliter times 1.8 milliliters. And remember, these milliliters cancel each other out. And then we find that in each cartridge, we have 36 milligrams of lidocaine. So the number of cartridges of 2% lidocaine that we could give to this 100-pound patient would be determined by dividing this MRD, 320 milligrams, by the amount of local anesthetic in each cartridge. And in this case, it's 36 milligrams per cartridge. So we divide 320 milligrams, the MRD, by 36 milligrams, how much lidocaine is in each cartridge, and we find out that we can give this patient 8.9 cartridges, up to 8.9 cartridges of 2% lidocaine. Okay, so if you're using different drugs, sometimes dentists or hygienists might use a cocktail of local anesthetic for a patient because the different types of local anesthetics have different onset times and things like that. So sometimes they'll want to mix them. So if you do use multiple drugs and they have different MRDs, you always want to use the lowest MRD when you're calculating your total drug doses. So if we have a patient that is given a combination of lidocaine and prilocaine, for instance, the MRD for lidocaine is 3.2 milligrams per pound, or a maximum of 500 milligrams. and the MRD for prilocaine is 4.0 milligrams per pound or 600 milligrams total, you're going to use the lower MRD always. And in this case, it's lidocaine. So you always want to give your patient the lesser amount, otherwise you risk overdosing them. So for a 100-pound patient, the MRD for lidocaine is going to be 3.2 times 100, which is 320 milligrams, whereas the MRD for prilocaine would be 4.0 times 100, or 400 milligrams. So you're going to go with the lower of those two. So the MRD for that patient is actually going to be 320 milligrams for both of the drugs together. Okay, so let's see what this looks like in action. So let's say we gave this 100-pound patient 2 cartridges of 2% lidocaine already, and now we want to switch to prilocaine for whatever reason. And we want to know how many cartridges of prilocaine can we still give this patient. So the first thing we're going to do is determine our MRD. And like we said, we're going with the lidocaine MRD because that's lower. So the patient's MRD was 320 milligrams, 3.2 milligrams times her weight, 100 pounds. And then we determine how much lidocaine has she already had. So with a 2% formulation, we have 20 milligrams of lidocaine per milliliter of solution. And then we multiply that by the size of the cartridge, 1.8 milliliters. And then we want to keep in mind that we gave her 2 cartridges. So you want to multiply that by 2 cartridges. A lot of times students will forget to do that part. So we gave her 2 cartridges, you can see up here. So 20 milligrams per milliliter times 1.8 milliliters times 2 cartridges equals 72 milligrams. So that's how many milligrams of lidocaine that we already gave her. So how many more milligrams of local anesthetic may she have to reach her MRD? So her original MRD is 320 milligrams, but we determined that we already gave her 72 milligrams of lidocaine. So 320 milligrams minus 72 milligrams means that she can have 248 milligrams more of local anesthesia. So if we're switching to prilocaine, we want to figure out how many cartridges is that. So the prilocaine we're using is 4% formulation. So we're going to figure out how much prilocaine is in each cartridge. So with 4% formulation, we have 40 milligrams per milliliter of prilocaine, and then the size of the cartridge is 1.8 milliliters. So when we multiply 40 milligrams per milliliter times 1.8 milliliters, we're going to find out that there's 72 milligrams of prilocaine in each cartridge. Okay, so how many cartridges can we give her? She can have 248 milligrams more of local anesthesia. So we want to divide that 248 milligrams that's left, divide that by the amount of prilocaine in each cartridge, 72 milligrams, and we find out that we can give her 3.4 more cartridges of anesthesia, or 3.4 cartridges of prilocaine in addition to the 2 cartridges of lidocaine that she's already had. Okay, to figure out milligrams delivered, and we do this quite a bit when we're documenting our local anesthesia in the chart, you're going to calculate the milligrams of a drug delivered. You're going to multiply the total number of cartridges by the total milliliters per cartridge. So for example, if you gave a patient 2 cartridges, and the cartridges were 1.7 milliliters of 2% lidocaine, you're going to calculate that a 2% formulation is 20 milligrams per milliliter. You're going to multiply that by the size of the cartridge. So remember, we always use 1.8 milliliters if we have a cartridge that's labeled 1.7 milliliters. So 20 times 1.8 equals 36 milligrams of lidocaine in each cartridge. So remember, we gave 2 cartridges, and there's 36 milligrams of lidocaine in each cartridge. So we just take our 36 milligrams of lidocaine, multiply that by 2 cartridges, and that tells us that we gave this patient 72 milligrams of lidocaine. Okay, so we always want to, you're always going to calculate local anesthetic and vasoconstrictor, unless the formulation doesn't have any vasoconstrictor, like 3% mepivacaine plain, you would just calculate the local anesthetic. But most of the anesthetics you use have vasoconstrictor in them. So you're going to first calculate the local anesthetic, and then you're going to calculate the vasoconstrictor because there's MRDs for both. So the key factors when calculating vasoconstrictor doses are the concentration for the selected anesthetic, the dilution ratios for the vasoconstrictors, the standard cartridge volumes, the MRDs, and relevant patient factors, basically from their medical history and their weight and things like that. Okay, so the MRDs of vasoconstrictors, these were based on recommendations from way back in 1954. A special committee of the New York Heart Association met and determined these MRDs. And then more recently, the American Heart Association weighed in with the recommendations for patients with ischemic heart disease. So the factors for dose calculations with vasoconstrictors are the drug concentration. Vasoconstrictors are expressed in a ratio. So levonorepinephrine is always in a ratio of 1 to 20,000, for instance. Epinephrine can come in 1 to 50,000, or 1 to 100,000, or 1 to 200,000 concentration. 1 to 50,000 is the strongest of those. Volumes and doses delivered, you have your solution in milliliters and your drugs expressed in milligrams. And then you have your drug MRD, or maximum recommended dose. Okay, so for vasoconstrictors, it's not based on weight like local anesthetics, the MRDs. So the maximum recommended doses or safe doses for epinephrine, no matter what the formulation is, whether it's 1 to 50, 1 to 100, or 1 to 200, for a healthy patient, it's always going to be 0.2 milligrams. That's always going to be your MRD for a healthy patient for epinephrine. And then for someone with ischemic heart disease, it's going to be 0.04 milligrams. So that's your quote unquote cardiac dose. So you may be using your cardiac dose for patients not necessarily with heart disease. Maybe they have like hyperthyroid or something like that, and you need to limit the epinephrine. You would use the cardiac dose. And then levonorepinephrine always comes in a 1 to 20,000 formulation. So levonorepinephrine is weaker than epinephrine, so you need more of it. That's why it's in a 1 to 20,000 formulation. So the maximum dose for levonorepinephrine for a healthy patient is 1 milligram, and the maximum dose for the cardiac dose is 0.2 milligrams. Okay, so this chart, actually, this is a little bit confusing. It's from your book. I'm going to skip over this and come right back to it because I have an easier way. Okay, so when we determine the amount of vasoconstrictor in a cartridge, you know, your vasoconstrictor is going to be expressed as a ratio. It could be 1 to 20,000, 1 to 50,000, you know, etc. So all you need to do to figure out the amount of milligrams of vasoconstrictor per milliliter in the cartridge is just take the ratio, for instance, 1 to 20,000, just take off those last 3 zeros and then divide. So you want to divide 1 by 20 for a 1 to 20,000 formulation, take off those last 3 zeros, divide 1 by 20, and you get 0.05 milligrams per milliliter. So in a ratio of 1 to 20,000, you have 0.05 milligrams of vasoconstrictor per milliliter in that cartridge. If the ratio is 1 to 50,000, just get rid of those last 3 zeros and then divide 1 by 50, and you find out that you have 0.02 milligrams per milliliter of vasoconstrictor in that cartridge. So, 1 to 20,000, 0.05 milligrams per milliliter. And if we go back to that previous slide, we see that 1 to 20,000, we have 0.05 milligrams per milliliter. 1 to 50,000, we have 0.02 milligrams per milliliter. And 1 to 50,000, 1 divided by 50 is 0.02 milligrams per milliliter. So that's a little easier than memorizing that whole chart, which is kind of what I want to avoid. It's unnecessarily difficult. So just remember the amount of vasoconstrictor is going to be listed on the cartridge. So it'll always say epinephrine 1 to 100,000 or whatever the ratio is. It will always be printed right on the cartridge. Okay, So how much vasoconstrictor is in each cartridge? So again, if you have a cartridge that's labeled 1.7 milliliters, we always do our calculations based on 1.8 milliliters because it's going to be closer to 1.8 milliliters in actuality. So what we're going to do is we're going to multiply the number of milligrams of vasoconstrictor in the solution by the size of the cartridge. So to figure out the amount of milligrams of vasoconstrictor in the solution, we're going to take the ratio, 1 to 100,000 in this case. We're going to take off those last 3 zeros. So we're going to do 1 divided by 100, and then we're going to multiply that by 1.8 milliliters, the size of the cartridge. So this is going to tell you how much vasoconstrictor is in that cartridge. So when you do 1 divided by 100 times 1.8 milliliters, you're going to find out that there's 0.018 milligrams of epinephrine in each cartridge of 2% lidocaine with 1 to 100,000 epinephrine. Okay, so now we know how much vasoconstrictor is in there, how much lidocaine is in there. So 2% is going to be 20 milligrams per milliliter, and then we're going to multiply that by 1.8 milliliters, and we're going to find out that there's 36 milligrams of lidocaine in each cartridge. So remember, you're going to have local anesthesia, and if there's vasoconstrictor, you have to figure out how much vasoconstrictor is in there as well. Okay, so what if we gave 2 cartridges of 2% lidocaine with 1 to 100,000 epinephrine? How much epinephrine have we given, and how much lidocaine have we given? So to figure out how much epinephrine, we're going to take this 1 to 100,000. We're going to take off those last 3 zeros. So we're going to divide 1 by 100, and that'll tell us how many milligrams of vasoconstrictors per milliliter. And we're going to multiply that by the size of the cartridge, 1.8 milliliters. And then don't forget, we're given 2 cartridges like it says up here, so we need to multiply by 2 cartridges. So 1 divided by 100 times 1.8 milliliters times 2 cartridges means that we've given this patient 0.036 milligrams of epinephrine. That's how much we've given them by giving them those 2 cartridges. Now we need to figure out how much lidocaine we gave them. So 2% lidocaine is 20 milligrams per milliliter times the size of the cartridge, 1.8 milliliters, times 2 cartridges because we gave them 2. And if you do 20 times 1.8 times 2, you found out that we gave them 72 milligrams of lidocaine in those 2 cartridges. Okay, so there's something called a limiting drug. So we have MRDs for the local anesthetic, and we have another MRD for the vasoconstrictor. So a lot of times those are going to be, well, almost every time, there's going to be different values based on the MRD for the vasoconstrictor or the MRD for the local anesthetic. So whichever one is less is going to be your limiting factor. So maybe based on the local anesthetic, you find that you can give 6 cartridges, but based on the vasoconstrictor, you can only give 2 cartridges. The vasoconstrictor would be your limiting factor because you can't exceed the MRD for either one. So what we're going to do is calculate the number of cartridges allowed according to the local anesthetic MRD, and then we calculate the number of cartridges allowed according to the vasoconstrictor MRD, and we use the lower of the 2 because we can't overdose them on local anesthetic or on vasoconstrictor, so you need to stick to the lower of the 2. Okay, so let's put this all together. This is kind of a typical word problem. How many 1.7 milliliter cartridges of 2% lidocaine with 1 to 100,000 epinephrine may be administered to a cardiac patient weighing 150 pounds if the MRD for lidocaine is 3.2 milligrams per pound with a maximum MRD of 500 milligrams? Okay, so step 1, we're going to determine the MRD of the lidocaine. Step 2, we're going to determine the MRD of the vasoconstrictor. And then step 3, we're going to identify the limiting factor, and that will determine how many cartridges we can give this patient. Okay, so step 1, we're going to determine the MRD for lidocaine for the patient. So we want to multiply the patient's weight by the MRD. So the patient's weight was 150 pounds, and we multiply that by the MRD of 3.2 milligrams per pound. and we get an MRD of 480 milligrams. Now that's less than that absolute MRD of 500 milligrams, so we go with the 480. So 480 milligrams is our MRD for this patient. Next, we want to determine the amount of lidocaine in each cartridge. So we've got a 2% lidocaine formulation. So remember, 2% lidocaine is 20 milligrams per milliliter, and then we multiply that by the milliliters in the cartridge, 1.8, and we find out that there's 36 milligrams of lidocaine in each cartridge. So the last thing we want to do to determine how many cartridges of lidocaine we want to give this patient is we divide our MRD by the amount of lidocaine in each cartridge. So that means we divide 480 milligrams, which is the MRD, by 36 milligrams, that's how much lidocaine is in each cartridge, and we discover that we can give this patient 13.3 cartridges. That's just based on the lidocaine. So remember, there's vasoconstrictor in there as well. So don't go giving this patient 13.3 cartridges just yet. Okay, step 2. This time we're going to determine the MRD of epinephrine, and this patient is a cardiac patient. So our MRD for epinephrine for all cardiac patients is 0.04 milligrams. We can't exceed that. So we want to determine the amount of epinephrine in each cartridge. So for a 1 to 100,000 formulation, remember you just kind of knock off those last 3 zeros and you divide 1 by 100, and that tells you that you have 0.01 milligrams per milliliter of epinephrine in these cartridges. So then you want to multiply that by the size of the cartridge. So 0.01 milligrams per milliliter times 1.8 milliliters equals 0.018 milligrams of epinephrine in each cartridge. Okay, then you want to determine how many cartridges can be administered to the patient based on the amount of epinephrine. So we want to divide the MRD. Remember, our MRD is kind of low because this is a cardiac patient. It's only 0.04 milligrams. So we take our MRD and we divide it by how much epinephrine is in each cartridge, which we determine is 0.018 milligrams. So when we divide the MRD by the amount of epinephrine, we find out that we can give this patient 2.2 cartridges. So if we go back, okay, based on just the lidocaine, we can give them 13.3 cartridges. But when we figure out what we can give them based on the vasoconstrictor, it's much, much lower. We can only give them 2.2 cartridges. And that goes back to them being a cardiac patient. They can have very little epinephrine. So the limiting factor is going to be the vasoconstrictor because you can only give 2.2 cartridges based on the vasoconstrictor. So in this example, the epinephrine is the limiting factor. Therefore, the maximum number of cartridges of 2% lidocaine with 1 to 100,000 epinephrine that this patient could have would be 2.2 cartridges. So always take the lower number. Otherwise, you can overdose your patient. Okay, pediatric doses. I don't test you guys on pediatric doses, but I just want to introduce you to the concept because we don't give local anesthetic to children in Virginia, so I don't concentrate too much on it. But when you determine doses for children, there's a couple different ways to do it. You can use something called Clark's rule, and with this you take the child's weight in pounds and then you divide it by 150 pounds, and that's the adult standard. So an example would be you have a 50-pound child and you're using 2% lidocaine, for instance. So what you're going to do is divide the child's weight 50 by 150, and then this will give you 0.33 or a ratio, 1/3. And you're going to take the MRD. This 300 milligrams, that's the MRD by the Association of Pediatric Dentists. So you take that MRD and then you multiply it by that decimal 0.33 that you got from dividing the child's weight by the standard, and you find out that you can give that child 99 milligrams of lidocaine. And then there's something called Young's rule, which is just another way to calculate pediatric doses. And with this, you take the adult dose and multiply it by the child's age, and you divide it by 12 plus the child's age. So, so the example here is, say, a 6-year-old child that's 50 pounds and you're using 2% lidocaine. Again, the lidocaine is 300 milligrams. That's the MRD based on the AAPD. So you multiply this by 6, the child's age, and then you take the product, 1,800, and you divide that by 12 plus the child's age, 6, and then you find out that this child can have a maximum dose of 100 milligrams. So here is the AAPD maximum recommended doses. This is the American Academy of Pediatric Dentistry. This is table 7-7. So these values are different than the values for adults. When you do your worksheet, don't get this mixed up with the adult table. Make sure you use table 7-1 because you can see here lidocaine for the AAPD, they recommend 2 milligrams per pound maximum and 300 milligrams maximum. So it's definitely less than the adult doses. So, okay, that's it for dosage calculations. I know it's a lot of information, but if you do the worksheet and follow that, and then we'll go over that in class very carefully, hopefully you won't have too hard of a time getting it. Most students usually get it pretty well after we have our class meeting. So just stick with me and we'll get through this, okay? Have a great day. Thanks for listening.